Good Friday afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dorothy Shephard, ministre de la Santé. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Dr. Russell.
Do you tell everybody to mute their mics?
Yes.
Okay. Happy Friday. I just wanted to start off with a little note that one of the communications team received today that was forwarded to me. And this is a little drawing of a heart with a beautiful little handwritten note inside from a little girl by the name of Maddie, who's 8 years old. And she did this last night and put it on her parents' bed before she went to bed. Her grandmother was babysitting her. And so this morning I got a note with Maddie's note. And it says, and it's got a drawing of her whole family inside a heart. It says, "We will stay together. We are in this together. COVID will not stand in the way. We do not let COVID get in the way of our happiness. We will not respect COVID. We all hate COVID." And then it has a picture of Maddie, Dave, the dad, Shannon, the mom, Cece, the sister, and Tilly, the dog. So anyway, that made my day this morning. A nice little way to start the day in terms of all the things that we have to face. So when you get your bucket of energy filled up with positive things like that, that's good. So good afternoon. Bonjour à toutes et à tous. When I spoke to you yesterday, and the Premier spoke to you yesterday, we talked about being prepared to move to a full lockdown to arrest the spread of COVID-19 whenever and wherever that became necessary. And for Zone 4, which is the Edmundston Grand Falls area, that time is now. So the growth of cases in this zone and its spread through several workplaces and long-term care homes has really reached the point where the strongest measures are needed. L'augmentation du nombre de cas dans cette zone et la propagation du virus dans plusieurs lieux de travail et d'établissements de soins de longue durée sont telles que nous devons prendre des mesures plus rigoureuses. Santé publique a recommandé au cabinet que la zone 4 passe à la phase de confinement complet à compter de minuit samedi soir. Nous visons ainsi à réduire les possibilités de transmission du virus en faisant en sorte que les gens limitent leurs déplacements le plus possible. Cette mesure signifie qu'il ne faut pas entrer dans la zone 4 ou en sortir sauf s'il s'agit d'un déplacement essentiel. Veuillez rester le plus possible à la maison avec votre bulle d'un seul ménage. Le confinement dans la zone 4 sera en vigueur pendant au moins 14 jours. Nous évaluerons la situation tous les 7 jours et le cabinet pourrait prolonger ces restrictions au besoin ou ralentir. Public Health has recommended to Cabinet that Zone 4 move to a full lockdown. This will take effect at midnight Saturday. Our objective is to reduce opportunities for transmission by having people limit their movements to the greatest extent possible. This means no unnecessary travel in or out of Zone 4, so please stay at home within your single household bubble as much as you can. The lockdown in Zone 4 will be in effect for at least 14 days. We will evaluate the situation every 7 days, and Cabinet may extend restrictions if required. Minister Shephard will outline the details of the lockdown phase in a few minutes. The measures being announced today are stern, but they are necessary. Consider these facts. On January 6th, there were 7 active cases of COVID-19 in Zone 4. That number doubled in just 2 days. By January 11th, the number of cases doubled again. 4 days later, it doubled a third time, and by January 19th, it had doubled a fourth time. From those 7 cases we reported 2 weeks ago, there are now 129 active cases in Zone 4. This includes 19 new cases being reported today in Zone 4. At the current pace, that number will exceed 200 active cases early next week and potentially 400 active cases before the month is over. There are now 309 cases per 100,000 people in Zone 4. That's nearly 6 times the rate for New Brunswick as a whole, which is 59 cases per 100,000. Le 6 janvier, il n'y avait que 7 cas actifs de COVID-19 dans la zone 4. Ce chiffre a doublé en seulement 2 jours. Le 11 janvier, le nombre de cas actifs avait redoublé et 4 jours plus tard, il avait doublé une 3e fois. Le 19 janvier, il avait doublé une 4e fois. Nous sommes passés de 7 cas actifs dans la zone 4 il y a seulement 2 semaines à 129 cas actifs à l'heure actuelle. Ce total comprend les 19 nouveaux cas que nous nous annonçons dans cette zone aujourd'hui. À ce rythme, la zone comptera plus de 200 cas actifs au début de la semaine prochaine et pourrait avoir 400 cas actifs avant la fin du mois. Il y a présentement 309 cas par tranche de 100 000 habitants dans la zone 4, soit près de 6 fois le taux pour le Nouveau-Brunswick en entier, qui se chiffre à 59 cas par tranche de 100 000 habitants. And we are testing more in this zone and seeing more positive results than anywhere else in the province. So we really can't let this go on. By locking down now, we hope to slow the transmission of the virus so that we can effectively trace cases as they emerge and get their contacts into self-isolation as quickly as possible. Zones 1, 2, and 3 will remain at the red alert level. As we have seen in Zone 4, circumstances can change very, very rapidly, and so we will continue to monitor the growth and the spread of the virus in these zones. Zones 5, 6, and 7 will stay in the orange alert level, and while case numbers remain low in these zones, we want to be sure that the virus is not accidentally carried from one of the other regions of the province to our neighboring or other neighboring jurisdictions. And so that's why we need people to stay at home. We also need people to continue to be tested if they have mild symptoms. Aujourd'hui, j'annonce qu'il y a 30 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Il y a 8 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de Saint John, Kings et Charlotte, il y a un nouveau cas. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a un nouveau cas. Dans la zone 4, comme je l'ai mentionné, il y a 19 nouveaux cas. Il y a un nouveau cas dans la zone 7, soit la région de Miramichi. Toutes ces personnes, si seules à l'heure actuelle, et la cause de ces cas fait l'objet d'une enquête. Il y a maintenant 331 cas actifs de COVID-19 dans la province. 5 personnes sont hospitalisées à l'heure actuelle, dont 3 aux soins intensifs. Today, there are 30 new confirmed cases of COVID-19 in New Brunswick. In Zone 1, which is the Moncton and southeastern New Brunswick area, there are 8 new cases. In Zone 2, which is St. John, Kings, and Charlotte counties, there is 1 new case. In Zone 3, which is Fredericton and the St. John River Valley, there is 1 new case. In Zone 4, as I mentioned, there are 19 new cases. In Zone 7, which is the Miramichi region, there is 1 new case. These individuals are all in self-isolation, and the cause of these cases remains under investigation. There are now 331 active cases of COVID-19 in New Brunswick. There are 5 individuals in hospital, including 3 who require intensive care. So please keep these New Brunswickers in your thoughts. I want to expand on comments I made yesterday regarding schools and COVID-19. And when I speak to you, I wear my physician hat, family physician, public health physician, but I'm also a parent. So I have 2 kids, 2 teenagers who attend school here in Fredericton. One of them has asthma, actually, and I wouldn't knowingly do anything to put their health at risk. So unless I get a call from public health informing me that they are a close contact of a case or a case, they'll be going to school in the red and orange alert level in those zones. That's why we're keeping the schools open, because schools are the safest place for for our children to be. And it's not just an opinion, it is rooted in science. So I know that's hard to understand if you don't have all the information in front of you. So I just want to let you know that as of January 19th, we have seen COVID-19 cases in 32 schools across the province, but we haven't seen a case where the virus was transmitted directly from one student to another. Of the COVID-19 transmissions in the schools, 20% were student to staff, 40% were staff to student, and 40% were staff to staff. So you see 80% of the cases were staff related, and less than 1% of all New Brunswick school students have contracted COVID-19 and been exposed in their school. Les écoles situées dans les zones en phase d'alerte rouge ou orange sont demeurées ouvertes car les écoles constituent l'endroit le plus sécuritaire pour nos enfants. Il ne s'agit pas d'une simple opinion. Cette décision est ancrée dans la science. En date du 19 janvier, des cas de COVID-19 ont été signalés dans 32 écoles d'un bout à l'autre de la province, mais il n'y a toujours pas eu de cas où le virus a été transmis directement d'un élève à un autre. De tous les cas de COVID-19 qui sont transmis dans l'école dans la province, 40% ont été transmis d'un membre du personnel à un autre, 40% ont été transmis d'un membre du personnel à un élève et 20% ont été transmis d'un élève à un membre du personnel. Moins de la moitié de 1% de tous les élèves de New Brunswick ont contracté le COVID-19 et été exposés les autres à l'école au virus. There is also many benefits to being in school that cannot be scientifically measured. We know that attending school has a positive effect on children, not just during the pandemic, but every day. Under difficult conditions, we see that children need the sense of security they get from school. In school, they are interacting with their peers in a safe environment, and by continuing to learn and play together, they acquire the skills they need to function during difficult times. The predictability of the school environment helps to counter all of the unpredictable things that are happening in their lives because of COVID-19. When we can maintain as normal a life as possible, we reassure children that everything is going to be okay. À l'école, ils interagissent avec leurs pairs dans un milieu sécuritaire. En apprenant et en jouant ensemble, ils peuvent acquérir les compétences dont ils ont besoin pour continuer à bien fonctionner en ces temps difficiles. La prévisibilité du milieu scolaire aide à contrer les répercussions de toutes les autres choses imprévisibles qui peuvent se produire dans leur vie à l'heure actuelle à cause du COVID-19. It is by example that we teach our children how to cope. When we model appropriate coping, we teach them how to more effectively cope in these difficult times. We all need to reach deep within ourselves in the coming days to find the resilience we require to get through the months ahead. Please look after your mental health, no matter what part of the population you belong in. Whether you're working, whether you're at home, everybody needs that support. So please do check our website for those mental health supports. Si vous avez des amis ou des membres de la famille dans la zone 4, communiquez avec eux. Faites-leur savoir que vous pensez à eux et que vous les appuyez en ces temps difficiles. Et je vous dis aussi que si vous avez des problèmes avec la santé mentale, vous avez besoin de support, s'il vous plaît, vérifiez sur notre site web pour tous les supports pour la santé mentale. Si nous appuyons les uns les autres et si nous suivons les directives et les consignes de santé publique, la zone 4 pourra quitter la phase de confinement le plus rapidement possible et nous pourrons la remettre avec le reste du Nouveau-Brunswick sur la voie de rétablissement. If you have friends and family in Zone 4, reach out to them. Let them know you are thinking of them and supporting them through these difficult days. If we all support one another and follow public health guidance and advice, we can get through this lockdown phase quickly and get Zone 4 and the rest of New Brunswick back on the road to recovery. Thank you very much.
Good afternoon, bonjour. Since the beginning of January, we have seen a concerning rise in COVID-19 cases across New Brunswick. We have taken steps to contain the virus, first moving the entire province to the orange level, and then moving 4 health zones to red. While case numbers are beginning to level out in most regions, the situation in Zone 4, the Edmundston region, is still escalating. We had all hoped it would not come to this, but unfortunately, it has become clear that further restrictions are required to control the spread of COVID-19. Based on the advice of Public Health, Cabinet and the All-Party Cabinet Committee on COVID-19 have made the decision to move Zone 4 to a full lockdown. This lockdown will begin tomorrow, Saturday, January 23rd, at 11:59 p.m. or at midnight Saturday night, and will last a minimum of 14 days. We wanted to give residents and business owners in Zone 4 an extra day to prepare as this new situation evolves. We have not been in a full lockdown since last spring. Over the last few days, we have been in regular meetings with Public Health to determine what exactly this lockdown should look like to have the greatest possible impact. I can now provide those details. During the lockdown, all K-12 schools and post-secondary facilities must close and move to virtual learning only. A device loaning program will be available for families of students in grades K-8 who do not have access to technology at home. If required, delivery or drive-through pickup processes will be available for families who need to access materials or supplies for their children. More information will be available through your school or school district. Non-regulated healthcare providers must close unless they can provide their services virtually. Regulated healthcare professionals can stay open with an operational plan in place outlining enhanced measures. They are encouraged to provide virtual services whenever possible. Indoor formal gatherings, including weddings and religious services, are not permitted. Funerals must be limited to a single household bubble. Religious services can only be held virtually. Public walking trails may be used for individual use, but people need to maintain 2 meters of physical distancing outside their single household bubble. Public spaces, including rinks, snow hills, and downhill skiing, are closed. Outdoor activities with members of your household bubble is permitted, such as snowshoeing, ice fishing, and cross-country skiing. But outdoor warming stations, gathering locations, are closed. Groomed managed trails for snowmobiles and ATVs are closed. Restaurant dining rooms, gyms, recreation and sport activities, entertainment centers, and salons and spas must remain closed. Farmers markets must also close. Only essential businesses are permitted to remain open. That includes early learning and childcare facilities, which continue to operate with additional health and safety measures. A wage top-up program of $3 per hour is being offered to early childhood educators who continue to work through the lockdown. Additional funding will also be made available to operators of open facilities through the COVID-19 grant to support implementation of increased health and safety measures. Stores that sell things like food, medication, and hardware supplies can stay open, but they may only sell essential items. This is different from last spring. We are trying to minimize interaction. Fewer people going out and about for non-essential reasons will allow us to get out of this lockdown faster. No lottery tickets of any kind can be sold in person. They may be purchased online only. Businesses that provide repairs, plumbing, electrical, environmental cleanup, transportation and cleaning services may continue to operate. Construction and maintenance operations, as well as essential manufacturing and processing services, are permitted. Restaurants are allowed to provide drive-through, takeout, and delivery options. Post offices, NB Liquor, and Cannabis NB stores will remain open. Vet clinics and animal hospitals can stay open with curbside animal drop-offs. Financial and lending institutions and customer contact centers can continue to operate, although virtual options should be used if possible. Public libraries will remain open only so people can access internet services. After our lockdown in the spring, we recognize that some people need internet access to connect with essential services. Law and accounting firms must provide their services virtually. Anyone who is able to work from home is highly encouraged to do so. If that is not an option, employers must limit employee contacts by assigning consistent shifts when possible and keeping a record of names and shift times. Common areas in workplaces for breaks or lunch are not permitted. A complete list of businesses that are permitted to operate will be available shortly on the Government of New Brunswick coronavirus website. I know these rules will impact many businesses, and I want to remind you that you do not have to face these challenges alone. The federal government has created a short online questionnaire available at canada.ca that allows you to describe your situation and explore supports that may be available to you. During the lockdown period, evictions will not be permitted. Landlords must wait until at least 10 days after the lockdown has ended to proceed with an eviction. Since Service New Brunswick locations will be closed, Zone 4 residents will be able to use expired licenses until 10 days after the lockdown ends. While in a lockdown, please continue to stay within your single household bubble, which can still be extended to include a caregiver, an immediate family member requiring support, or one other person who requires support. With schools closed in Zone 4, we understand that essential workers may have concerns about making appropriate childcare and virtual learning arrangements. That is why, while under lockdown, a single-family household bubble can extend care to children from another household bubble for the purposes of informal daycare or online education support. This must be the same household bubble for the entire lockdown period. Carpooling with others for work, school, medical appointments, or to access essential services such as groceries is permitted. When carpooling with passengers outside your household bubble, continuous mask use and maintaining physical distancing is required. Public transit is allowed with physical distancing and the continuous use of a mask. Taxis are also permitted with continuous mask use, but passengers must sit in the back seat and must be part of the same household bubble. Everyone should stay home as much as possible. Please only leave your home for essential reasons, such as buying necessary items like groceries, going to work if you cannot work from home, medical appointments, or for childcare and custody arrangements. There should be absolutely no non-essential travel in or out of Zone 4 at this time. We know that the virus doesn't travel alone. It travels because people travel. That is why we are tightening travel restrictions for those entering New Brunswick. These new rules will also go into effect tomorrow, Saturday, January 23rd at midnight, and will apply to all health zones. Generally speaking, people entering the province will have to isolate for 14 days away from others. There are few exceptions to that. Those who travel back and forth daily for work, truck drivers, and those who must travel for medical care, childcare, and child custody. Those travelers will still have to be tested weekly and we will be improving testing access to help with that. People from Louis-de-Quay and Pointe-à-la-Croix can still cross the border for medical appointments and to fulfill child custody arrangements. They can also come once a week to purchase essential items. They will be subjected to mandatory weekly testing. I know these restrictions will be difficult to follow. We are asking a lot of New Brunswickers, particularly now residents of Zone 4, and I do not take that lightly. As Dr. Russell has said, the cases we are reporting are only the ones we know about. We can only assume that there are more cases in our communities that have not yet been confirmed. While Zone 4 is moving into lockdown, Zones 1, 2, and 3 will remain in the red level. Zone 5, 6, and 7 will remain orange for now. We are constantly reassessing the situation. We will be meeting with public health in the days ahead, and if the numbers are trending in the right direction, we may be able to move at least Zone 2, the St. John region, and Zone 3, the Fredericton region, back to orange. No matter where we live, we must behave as though COVID is all around us. Please follow the rules that apply to your health zone. If you are experiencing even one symptom, self-isolate at home and contact 811 to arrange to get tested. You can also help protect yourself by downloading the COVID Alert app on your phone. By following the rules, we can get our province back to less restrictive levels. Please continue to wear a mask, keep a safe physical distance from others, stay in your single household bubble, and avoid traveling to other zones. New Brunswickers are resilient. We have worked hard since this pandemic began to slow the spread of the virus. For months, we were able to enjoy a more normal life with fewer restrictions. I know that we can do that again. By working together, we will make it through this current situation. Let's do our part to move New Brunswick back to the yellow alert level. Thank you. Merci.
Thank you, Minister. Thank you, Dr. Russell. Merci beaucoup, Madame la Ministre. Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question et un suivi. Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? We'll now proceed with questions from members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the language of your choice, and please ensure your microphones are placed on mute.
Speak clearly in the phone.
Adil Ibrahim, CBC.
Thank you. This question is for Dr. Russell. What do we know, if anything, about how the outbreak at the poultry plant started and how much that outbreak precipitated in cases to where we are now?
The contact tracers in that zone have been doing a lot of work, and we actually have a relatively good idea of all the outbreak clusters that are connected and those that are not. And I'm pretty sure that in Zone 4 there are several different clusters, including clusters that haven't been linked yet. So I can tell you the number of cases in total that are from the Nadeau poultry farm that had been diagnosed. There are 28 employees. But in terms of how many that has contributed to the outbreak, as I mentioned in my speech, the cases doubled every several days over the course of the last 2 weeks. So some of those were as a result of the Nadeau cases. But the Nadeau cases, the investigation is still going on. And really, those cases only came to light with respect to the mass testing that's being done every several days at that time. So whenever that would have started, then you would have seen more of the cases turning up there. But in terms of how they've contributed overall, I can just tell you that the total number is 28 out of the active cases that are there now.
Ms. Ibrahim, do you have a follow-up?
Yes, so the South African and UK COVID variants were both detected in Nova Scotia. Have either of them been detected here, and how will their appearance in Nova Scotia affect our border policy with that province and workers who go back and forth there?
Well, we are very concerned about that variant coming into New Brunswick, and so any measures that we look at between Nova Scotia and New Brunswick will definitely take that into account. But as of right now, we have travel restrictions that are based on our other borders with Quebec and Maine, but I don't think they apply to PEI in Nova Scotia, but I'm going to let Minister Shephard speak to that.
I will just add, there will be I'm sure, a list of the travel restrictions put on, but we have strengthened travel restrictions for out-of-province travel, and so there will be mandatory isolation where there hadn't been before, with some exceptions. There will be weekly testing where there hadn't been before, with some instances. So we have strengthened cross-border travel.
Thank you, Ms. Ibrahim. Jean-Philippe Hugues, Radio-Canada. Jean-Philippe.
Oui, bonjour. Si la situation est aussi urgente que vous le dites pour la zone 4, pourquoi attendre à samedi pour imposer le confinement plus rigide plutôt que de le faire finalement dès ce soir?
Maybe Dr. Russell could follow me en français. The reason we're giving 36 hours is for public safety to get in place. It's for people to prepare, to know that some businesses are going to close and they won't be able to access them. Of course, time is of the essence, but we also know that this will be a more difficult period for many people. We want to make sure that they have the supplies they need in order to proceed, to go out as little as possible once the lockdown is in place.
Alors, juste pour répéter ce que le ministre Shephard a dit en anglais, on donne le temps à les entreprises pour préparer, pour fermer. On donne du temps à le département de sécurité publique pour aussi faire des préparations. Alors, c'est pour ça qu'on donne les gens du temps pour préparer avant les changements.
Monsieur Hugues, as-tu un suivi?
Oui, j'aimerais savoir s'il a été question aussi peut-être dans une autre phase ultérieure. Est-ce que les discussions au sujet d'un couvre-feu, est-ce que c'est quelque chose qui pourrait arriver éventuellement?
Again, I'll respond and ask Dr. Russell to follow me up. Curfew has never been off the table, sort of speak, but we believe that with businesses closed, with takeout only, with delivery services, the curfew is not as necessary at this time. So it really wasn't on the table for this discussion. It has been on the table prior, but with all of the restrictions in place, we felt that we were sort of eliminating the need for that.
Merci, Monsieur Hugues. Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question is either for Dr. Russell or Minister Shephard or both. Of the children under 18 who've contracted COVID-19 in New Brunswick, what has the spectrum of their symptoms been, and have any been serious cases?
Hi, Vicki. Thanks for the question. I don't have that kind of granular information. I can just talk in broad strokes about the likelihood that a lot of them were asymptomatic, and the likelihood that if they did have symptoms, they were mild, because that is the data that we see in other jurisdictions. But I don't have that granular level of detail, but I'll see if I can get it for you.
Follow up, Ms. Hogarth.
Thank you. Do we have a projected timeline for when all residents of long-term care homes will be vaccinated, and approximately when can teachers and child care providers expect to be offered the vaccine?
So we have information on our goal, our target is end of March to have all the long-term care facility residents vaccinated. And again, that's all predicated on supply, and we don't have control over the supply, as you know. And so the next level after that priority group in after March, we're still working on those details. Again, it's all predicated on supply, and it is still under discussion in terms of, you know, we had one iteration, many iterations actually on our in terms of our discussions, and it probably will change again. So people have asked, well, why aren't you putting any information on that out? Well, whatever information we do put out on what our plans are, please know that it's a work in progress. It's under construction because the timelines will keep changing, and some of the things, some of the information that we receive will continue to change. So we have to be flexible and evolve with it. But the plan would be in that second quarter, so in April to June, we would have another level of priority groups identified then. But for the general population, I think what the general population needs to know, if you're relatively, you know, healthy and under the age of 55, you would be prioritized in the very last group from June onward. And that's what's on the federal website as well around, you know, our goal is to have everybody vaccinated by the end of 2021. But we're hopeful that the majority of the people that don't get vaccinated, because of the limited number of doses, which again, we don't even have all the exact numbers and details on, that the majority of the population will be able to get vaccinated from June onward. But in that second, so the first phase will be long-term care facility residents, healthcare workers, people 85 and over, and adults and First Nations, adults and First Nations communities. But for that second quarter, we're still working on that, but it will be people 75 and over, and some other groups and first responders. But again, that's under discussion. Again, everything keeps changing with respect to the timelines and the dosages, and the vaccines are going to be available. So, and pharmacists are included in that second quarter.
Thank you.
Thank you. Laurel Lyle, CTV.
Thank you, Bruce. This question is for Dr. Russell. Dr. Russell, do we currently have any outstanding samples from New Brunswick that we're waiting to have tested to see whether or not they are variant forms of COVID-19, like has been detected in Nova Scotia?
To my knowledge, we sent 5 that came back negative already. My understanding is there would be 6 that are outstanding right now that we're waiting to receive information on.
Do you have a follow-up, Ms. Lyle?
I do, thank you. This would be a question for either Dr. Russell or the Minister, but how much of a problem is people traveling between health zones? You know, what is it you're seeing on that front?
I'll just speak a little bit on the transmission side. We have seen transmission across zones. That is very, very common. So we obviously, with the zones that are in the orange, or sorry, in the red level right now, we want to stop that transmission across zones. I mean, there are some zones that either have no cases or very few cases, and we certainly don't want them to start popping up there. So again, limiting your travel for essential reasons only is very, very important, because the only way to stop COVID is to stop moving, and that's how you stop the transmission.
I can just add a little bit to that, Laura, that you know, public safety is really the ones who would keep data on this. I don't think that it is a prevalent problem. I think the majority of New Brunswickers are really doing everything they can to slow the spread of COVID. And with some of the more higher levels of orange and red, people have been pretty compliant in helping us keep the spread down. So I don't have any real data for you, but we can check with public safety to see if they have anything to share.
Marie Sutherland, CBC.
Hi, yes, so further to that, Minister Shephard or Dr. Russell, are you saying then there won't be any enforcement of traveling outside of zones, like particularly in Edmundston, if it's in full lockdown?
What I'm saying is that people can travel for essential reasons only. And so if there is an obvious non-compliance, I do believe that public safety is issuing fines, and I'm sure that that there will be consequences to some who decide to travel for non-essential reasons. But the majority of New Brunswickers are complying, and we hope they continue to do so. We encourage them to do so. It is with their help that we can stop this the spread.
Ms. Sutherland, do you have a follow-up today?
Yes, I do. Dr. Russell, we have been made aware of a report of supply teachers teaching at a school that was closed later that day because of a confirmed case, and then teaching the following day at another school without first being tested. And I'm wondering if you're aware of this incident, and are supply teachers somehow flying under the radar? Are they included in the red phase rule?
I'm just going to answer another question. I'm coming back to the UK variant that somebody else asked about. We've actually sent 19 specimens to NML, which is the National Microbiology Laboratory in Winnipeg, since December 23 to get sequenced for the variant, and we've had 8 negative results, and we have 6 more to come this week. More specimens have been sent recently in the last 2 weeks, just because there have been more cases overall. But coming back to your question about a supply teacher, I can't speak to specific situations or cases. I can just let you know that, when Public Health does the investigation with EECD and the school involved, whatever school is involved, they're working at the regional level, at the local level on those issues.
Thank you, Ms. Sutherland.
Okay,
Emma
sorry,
McPhee.
can I just follow up on that just a little bit? So I'm not asking for speaking to specific incidents at all here, but I'm just wondering, are supply teachers then, they are included on this red phase rule that all teachers and staff must be actively screened each day?
Well, we can talk to education about what that all entails, but my understanding is that if a school has a case that's positive, the contact tracers work with that school, with the principals, with the community, the school community rather, to educate and make people aware of the situation, and they have operational plans around that.
Thank you, Ms. Sutherland. Emma McPhee, Telegraph-Journal.
Yes, my question is for Dr. Russell. In the red phase, school buses may operate at full capacity, while public transit buses must have 2 meters distance between riders, which is about 9 riders per bus. So why are school buses considered safer than public transit buses? And is there any move to increase passenger limits in the red?
So EECD has a very robust operational plan around school buses. So in any outbreak situations, the contact tracing is very easy because there's a record of all the kids and where they sit and if they're siblings or not, and they're allowed to sit in the same seat, and if not, they have to be, every other seat. That's why they had asked parents at the beginning of the school year to voluntarily offer to drive their kids to reduce the number of kids that are on buses. So again, when we've done contact tracing, when there's been cases affiliated with schools, again, they have a very robust operational plan to help with the contact tracing. So it would be in that operational plan, and we've been working with that, and we're comfortable with that.
Ms. McPhee, do you have a follow-up?
Yes, I do. I'm wondering, have any Parkland St. John workers been disciplined or have been charged under the Emergency Measures Act during the outbreak there?
I didn't hear the question. Sorry, I didn't hear the question.
Can you repeat that, Ms. McPhee?
Yes. I'm wondering, have any Parkland St. John workers been disciplined or have been charged under the Emergency Measures Act during the outbreak there?
I have not heard of any such thing. Yeah. No. And just coming back to the question around the school buses, so the transit system, the changes that Minister Shephard was announcing today are really around the lockdown phase in terms of what would be allowed for transit. And for school buses, since there's no school in the lockdown phase, so the buses run the same way in all phases for the schools.
Thank you, Ms. McPhee. Danielle Edwards, Canadian Press.
Hi, I believe this question is best answered by Dr. Russell, but I wanted to ask if there's any sort of evidence as to why New Brunswick is kind of in this position where cases seem to be rapidly increasing and the rate of transmission is increasing. especially considering that other provinces in the Atlantic region seem to have kind of gotten it under control.
Hi there, the translator can't hear you. Are you able to repeat the
Can
question
you
and
be a
speak
bit
up?
louder, Ms. Edwards, please?
Sure. I'm asking if Dr. Russell could explain if there's any sort of evidence as to why New Brunswick has kind of found itself in the position that it's in, considering that other provinces in the Atlantic region, including Nova Scotia and Newfoundland, seem to have gotten their case count under control. It seems like there's definitely concerns about increasing rate of transmission of the disease.
So for New Brunswick, you know, the cases that we've seen that originated, the outbreaks that we're seeing now across the province, really started with the holiday season and Christmas gatherings and New Year's gatherings where people attended with symptoms. So that's really how everything started here, and the travel-related cases have continued during that time as well. You know, I can't say why there are more travel-related cases here than PEI or Nova Scotia, but certainly we still see quite a number of travel-related cases. And we assume that's going to continue, with the exception that now that we're having stronger border measures and stronger measures for travelers, then hopefully that will decrease. So there are multiple risks with New Brunswick in terms of being next to Maine, being next to Quebec, and those populations, those jurisdictions have increasing number of cases and had increasing number of cases, and we are in such close proximity to those places. The number of cases going up in all jurisdictions in Canada and in the US and globally means that the risk of a traveler bringing, every traveler has a higher risk of bringing COVID with them, and now we are worried about the UK variant. So we haven't found it yet, but certainly we're very, very concerned about it. So I think it's a combination of our proximity to our borders, perhaps a higher percentage. We do know, actually, Department of Public Safety gave us the information around how many more travelers we had over the holiday season. And we had almost 3,000 more travelers around that period of time than we normally do. So we do know that the number of travelers did go up. And again, each one of those travelers brings an increased risk of travel-related cases. So those are the combination of conditions that we experienced here, and obviously has contributed to ongoing spread.
Thank you, Doctor. Ms. Edwards, do you have a follow-up? Ms. Edwards, do you have a follow-up today?
Oh, so sorry. I was on mute. I'm so sorry. Yes, I do have a follow-up. I wanted to follow up on a comment that Premier Higgs had made in the previous briefing about the fact that zones 1, 2, and 3 could be moving to the orange level of the recovery plan in a matter of days instead of weeks or months. Is there a timeline for pushing those particular zones back to orange?
We have found that zones 2, 5, 6, and 7 are trending in the right direction. And so in the coming days, we will be meeting again with public health to assess that. We rely on public health assessments for that to come forward. And so when that does, we will convene COVID cabinet and cabinet to make those decisions.
Okay, thank you.
Hold on, Ms. Edwards.
Yeah, we will be assessing that on a daily basis. But in terms of, you know, when would we realistically see the right kind of trends for enough days in a row? Definitely, we could be having those meetings as early as the weekend, perhaps Sunday or Monday. But again, we will just keep following the data. The other thing I wanted to add around the combination of factors that contributed to our outbreaks here in New Brunswick, we did have a lull in our testing over the holiday season. We definitely had way fewer people getting tested, and we know that, again, people who were going to workplaces and gatherings with symptoms did not know they had COVID-19, and therefore they did not know that they were contagious. So that was a problem. We've bounced back from that, but we still have a couple of zones where we're not completely convinced that the testing is as high as it should be. In fact, Zone 7 is one of them. We do have additional assessment centers that are opening soon. One just opened up in Olac, or Clare, sorry. We have one opening up soon in Sussex, one in Sackville, one in Perth Andover. And there might be also Perth Andover began taking appointments today, and the location is at the Perth Andover Baptist Church. So trying to boost our testing, definitely, if people have symptoms, even if it's one symptom and even if it's mild, people need to get tested. We are seeing a lot of transmission from people who did not get tested. Even if they had a mild symptom, they did not realize it was COVID, they did not realize that they were contagious, and they went to work or school or a gathering and transmitted it that way.
Thank you, Ms. Edwards. Thank you, Doctor. Callum Smith, Global News.
Thanks, Bruce. My question is for Dr. Russell. Dr. Russell, I've noticed a bit of a change in the education policy on the EECD website between January 17th and January 20th. The updated information says all school personnel are now required to get tested after a positive case within the red phase. I'm wondering if that includes students and if this is also the case in the orange phase.
It's the staff only.
Mr. Smith, do you have a follow-up?
And I believe that it's in the red phase because that's the time that they would be closing schools if there was one case. I don't think that's the same protocol in orange phase. They wouldn't be closing a school in the orange phase because of a case.
Thank you, Doctor. Mr. Smith, do you have a follow-up?
Yeah, and just to back up a bit, I guess on that point, we've heard all along, no news is good news. I'm wondering why people aren't required to isolate until they receive negative test results. I understand in some cases the schools are closed, but more so thinking of people being out in the community after a possible exposure.
We do want people to self-isolate if they are waiting for the results. The people that are in zones that are red, they need to self-isolate while they're waiting for their test results, even if they only have one symptom.
I think I could clarify that when no news is good news was referred to, it was referred to when public health was doing contact tracing for a school. And so I believe Minister Carty mentioned that no news is good news. If you don't hear from public health, then you're okay. You would be contacted if you were at risk and need to isolate or get tested.
Mr. Smith?
I think that covers it. Thank you.
Thank you. Simon Delattre, l'Acadie Nouvelle.
Oui, j'ai une question au sujet de finalement les attentes pour les écoles. Qu'est-ce qu'on attend en termes de continuité des apprentissages pour les élèves et pour s'assurer de leur bien-être de ces prochaines semaines?
Monsieur Delattre, peux-tu parler plus fort dans votre téléphone, s'il vous plaît?
Oui, absolument. Donc, ma question est de savoir comment seront assurés la continuité des apprentissages pendant ces 2 prochaines semaines dans les écoles et aussi comment les écoles vont rester en contact avec les jeunes.
The good thing is, or bad thing, is that this is not the first time that there has been a lockdown in the province. We learned a lot from our early on lockdown in March, April, May, etc. And so virtual learning really has become a staple within our school system. EECD has a very large and robust plan to deal with school shutdowns. And so internet access, of course, is important. That's why we're keeping our libraries open for students who maybe don't have internet at home. And teachers have become very creative in staying close to their classes. So I don't perceive it as a serious problem. I perceive it as a challenge, and EECD has a good, robust plan to deal with it.
Monsieur Delattre, as-tu un suivi cet après-midi?
Oui, j'ai une question par rapport au foyer de soins. J'aimerais savoir si est-ce que le syndic les visites seront interdites ou restreintes d'une certaine façon.
Peux-tu répéter, M. Delatte?
C'est plus fort, s'il vous
Plus
plaît.
fort, Simon. Plus fort.
Oui, la question est de savoir si les visites seront permises dans les foyers de soins.
Dans les phases orange ou rouge ou...
Dans la zone 4.
The lockdown.
Non.
No. Merci, M. Delatte. Andrew Waugh, Brunswick News.
Yeah, hi. I may have missed this. I'm just wondering, what's the plan for rapid/mass testing in Zone 4 now that things are so far out of control?
Hi, Andrew. We're not doing mass testing at this point in time. We are continuing with our targeted testing. So we did open up another testing center in Madawaska in Clare, correct? Clare. And because there were people that would find it inconvenient to drive all the way to Edmundston. We are continuing to do any of the long-term care facilities or adult residential facilities that are impacted, they're being all mass tested. The NADO facilities being mass tested. And in Clare right now, that testing center is quite busy, so they're going to extend the hours there today. So there's lots of access for testing. The best testing, Andrew, is really testing people who have symptoms. And that's sort of what got us into trouble in the first place, is that people who had symptoms did not get tested. And I do want to give another plug for Zone 7 because they're testing. We had a conversation, Andrew, you and I, the other day, and when I re-looked at the numbers, we really do need to get those numbers up in the Miramichi. So testing is the key. Targeted testing is the best way to use our resources in terms of finding cases. We do test asymptomatic close contacts on day 10. We do a lot of testing. We do a lot of sentinel testing and travel-related testing for workers who are essential, who are crossing the border. So that's continuing. We also do pre-op testing as well. So there are many other opportunities for asymptomatic testing to be done, but we're not going to do a mass asymptomatic testing. We did 2 rounds of that in Zone 5. One in the first outbreak they had, and over 5,000 people were tested. They all came back negative. And in the second round of testing, when Zone 5 had another outbreak, we did over 3,000 tests, and 2 of them came back positive. And one of those people actually had symptoms. So they really should not have been mass tested for, in that group. But so that's what we're working with for now.
Mr. Waugh, do you have a follow-up this afternoon?
Yeah, I do. Thanks. Minister Shephard, I want to go back to the question that Marie Sutherland was talking about. Why wouldn't you set up checkpoints on roads and highways now? I mean, this section of the province is by far the most out of control, but your answer was kind of like, well, we're going to encourage people not to do it, and if we catch them and they're not traveling for essential reasons, then they'll get fined. But how exactly do you plan to catch somebody who's driving down the Trans-Canada? Are you just going to pull them over for no reason? How's that going to work?
Hi, Andrew. I'm going to take that question because it did come up in our discussions, and the resource allocation for making sure that any of these pieces of the mandatory order are enforced, whether it's in the mandatory order or not, there are a lot of enforcement issues that just require a lot of resources. So in terms of a targeted approach, they've always been very helpful with us when we wanted to do spot checks with WorkSafe around workplace issues. With respect to travel, my understanding is that, with the resources we have available, that if somebody is pulled over for a reason or another, they will get asked about their reasons for travel at the same time.
Thanks.
Thank you, Doctor. Thank you, Mr. Waugh. Paige Woodard, Miramichi Leader.
Hi, my question is for either Dr. Russell or the Minister. Before today's positive case was announced in Zone 7, both MLA Michelle Conroy and Miramichi Mayor Adam Lorden had expressed their frustration that Zone 7 remained in orange, citing conflicting messages about testing numbers in the zone. The mayor was told by public health that testing numbers were too low and needed to be up before it moved to yellow. And just last week and a few days ago, Dr. Russell said it was on par with St. John's. So are you able to update us on how the province is monitoring Zone 7 and what it's looking for in terms of quantifiable data to return to yellow?
Thank you for the question. And I know that Miramichi is really wanting to go back to the yellow phase. They've done a really good job. But you know, when the house is on fire, you don't leave anyone in it because one room isn't burning. And so the fact of the matter is that we need for everyone to be part of the solution. And when you have red and orange zones all around you, chances are there's going to be transmission into your zone for one reason or another. So we understand the want and the desire to get back to normalcy. But it is really imperative that we all are in this together. Over the next couple of days, we will certainly be looking at the trends as they've been going very well. As Dr. Russell said, though, recently, the testing in the Miramichi is very low. And so we don't know if people if they have symptoms and are not getting tested, or if there isn't any COVID there. But when the testing is so low, it's hard to depend on that. So we're asking all Miramichiers to keep in the fight with us. We need their help. We assess this on a daily basis. And as soon as we can, return other zones to an orange or yellow level, we will certainly do that.
And I'll just add one point. I may have added to the confusion the other day when I was speaking with Andrew Waugh, and because I do have the results of the testing here. And between December 20th and January 20th, the provincial average for tests, the provincial number of tests rather, was 34,469. And that's 59.41 per 100,000. And Miramichi in Zone 7 is the lowest number of tests per 100,000. They're at 4 tests per 100,000 population. And in Zone 4, we're at 308 tests per 100,000. So, and in terms of all the other places in the province, they're all hovering around, 40 or 50 tests per 100,000. So, in terms of the positivity rates and all those things, it just, Zone 7 is needing to have more tests for sure per 100,000.
Thank you, Doctor. Thank you, Minister. Ms. Woodard, do you have a follow-up today?
Yes, I'm wondering if you guys have a target in mind for where you'd like to see Miramichi reach before you have the confidence to return them to yellow.
I think the confidence level needs to be that the areas around them continue to decline, that their testing numbers go up. I don't know if we have a target, but as we see them go up and we see that those case counts are still low, that gives us more confidence that, that we could potentially move them. I've said this before, the virus doesn't move, people move. And so from one zone to another, we ask that people not travel between zones if it's non-essential. And we continue to encourage that. Because just like New Brunswick was in a really, really good position at Christmas time, it can change very quickly.
Ms. McKinnon, Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, teachers at Riverview High are still waiting to hear when they'll be tested after a positive case was confirmed there on Wednesday. Can you explain why the delay in testing teachers who have been ordered to report to a building where there is a case, possibly in a colleague, and how will this affect plans to keep the schools closed for 3 days?
Well, all I can say is that at the regional level, those would be things that would be worked out there. With respect to being in an environment where there may or may not have been a case, obviously the person who tested positive, whether it was a student or staff, is now self-isolating at home. And if people are following public health guidance and remaining 6 feet apart and wearing their mask and disinfecting and following all the protocols, then going to that environment to await testing and do the work that EECD is expecting of them. Again, that is part of the operational plan at this moment in time, and the operationalization of that would be done at the regional level with our regional teams.
Follow up, Ms. McKinnon.
Yes, thank you. Minister Shephard, the teachers union says the directive for the teachers to teach from the closed school, even though they're set up to teach from home, came from the Department of Education and the Treasury Board. Is this part of the government's wider directive to all public servants to report to the office? And what can you tell us about that?
Can you repeat it?
Yes, the teachers union says the directive for the teachers to report to the school to teach from the closed school instead of from their homes, even though they're set up to be able to do it from their homes, came from the Department of Education as well as the Treasury Board. Is this part of the government's wider directive to all public servants?
Bobby Jean, I am going to have to refer that question to EECD and Treasury Board. It's not a directive I'm aware of, so I would like to be sure that you get the proper answer on that.
Thank you, Ms. McKinnon. Gilles Duval, TVA. Gilles Duval, TVA. Savannah Odd, Telegraph Journal.
Hi, and happy Friday, everyone. My question is for Dr. Russell. I'm wondering why the province has been using just a small portion of its point of care and antigen rapid test supply. Of course, they're not as accurate as PCR tests and can't replace them, but I'm wondering, wouldn't we catch more asymptomatic cases entering high settings like long-term care by screening with a rapid test versus just using a symptom list or a temperature check?
Great question. So we have a certain number of, so the gold standard that we use is the PCR test at the lab at Georges Dumont. The second best thing we have in terms of PCR and being able to get a test result pretty quickly is the Gene Expert, but those are pretty limited in terms of how we use them and when, but they are very accurate whether you're testing somebody who's asymptomatic or symptomatic. All of the other ones, whether it's the Abbott ID or the PanBio, do not work as well when you're testing asymptomatic people. And even if you're testing symptomatic people, you still need to have a confirmatory PCR test. So you will always have to double swab the positive cases, and you're not 100% sure that you're going to a negative is actually a negative. So there are some downsides, but we do have some limited uses that we are planning to use the Abbott ID now tests, and I do have that list in front of me. So basically, the Abbott ID now is the rapid screening test. It's an antigen test that we will be using at the discretion of the regional health authorities. And if there is, sorry, I'm getting the Gene Expert list is here and I'm trying to find the Abbott ID list. Okay, so it's going to be used in all facilities with emergency departments. So for this rollout, the facilities will place the Abbott ID now instruments within their respected laboratory and inform emergency to send the specimens directly to the lab. And discussions are taking place right now with our partners, the regional health authorities and Extramural and Ambulance New Brunswick, about the use of Abbott ID for nursing homes and long-term care facility outbreaks. So they are used for screening only, and they, as I said, they do require the confirmation of the gold standard PCR diagnostic test at the Georges Dumont. And the current capacity for New Brunswick laboratory COVID diagnostic testing is still, we do have the capacity to continue with our turnaround time of 24 to 48 hours. So, with respect to the antigen screening test can also be used for shelters and correctional facilities, but there hasn't been any request up until now to do that. And so the Abbott ID now is going to be available in smaller hospitals and some community health centers. And the inventory of those machines and the supply is higher than the Gene Expert. But again, the trade-off is that The gene expert is more sensitive, particularly for the for asymptomatic individuals. But the problem with the gene expert is the supply is just not as high as the Abbott ID now. So so the supply of the Abbott ID is good, and it's easier to replenish. But again, it's really only beneficial if you're using it with symptomatic patients within 7 days of the onset of their symptoms. And again, it does still need the confirmation from the George Dumont lab. And then in terms of the PanBio, we're not really using it in New Brunswick at this time. It just has a very low sensitivity and specificity. So not only do you have to do a confirmatory test for the positives, but you also have to confirm the negatives. So again, if you have a negative test result, then it's not really giving you, a great amount of information. So I think I've covered those rapid tests. And do you have any follow-ups?
You have a follow-up, Ms. Odd?
That was super thorough answer, so I don't actually think I have a follow-up on that. I did have a question for the minister, just around schools and the lockdown in Zone 4. I'm told by community groups that work with students with disabilities that while educational assistance are provided in schools based on need, the equivalent home support through social development is actually based on income, which could leave some kids without that support in the lockdown phase in Zone 4. So I'm wondering, are there any discussions happening in government at this point to make sure every, or I guess the most possible number of students in Zone 4 with an EA at school will also get that at-home support?
So I would have to check with the EECD and social development to answer this accurately. I will say that we always try to meet the needs of families. And so, of course, a lockdown is for a short, hopefully the shortest time possible. We say 14 days on this. And we hope we can see it at 14 days or certainly not much longer if it has the effect that we're looking for. So I would have to defer to social development and EECD to see what those services could be provided and go from there. But we'll get you that information as soon as possible.
Thank you.
Thank you, Ms. Odd. Mesdames et messieurs, ladies and gentlemen, that concludes today's update. Thank you. Voilà la fin de notre mise à jour. Merci beaucoup.